the demands that led to the strike in the first place. How much of it has been met?
Well, thank you very much once again. Good morning, listeners. Well, the demands, as it were, um, I can say about 40% of it was attended to,
Okay.
while the remaining 60% are still work in progress.
Okay, for the
And we are,
40%, can we get a few of them? If you can mention a few of them, because we know there were 10 demands that were submitted to the government by the Uyilawa administration. If you can mention a few of them that have been met.
okay, yes, the issue of the abolishment of the bench fee was conclusively addressed,
Okay.
and that has been led to rest. The issue of payment of some of our house officers who were not paid some months of salary
Mm-hmm.
have been paid, even though we have recent issues that are propping up, but those ones that were on ground before the strike have conclusively been resolved.
Okay.
So we have issue of the medical residency training fund, which the government uh, did not capture it in the 2021 budget. It was subsequently captured in the supplementary budget.
Mm.
However, the capturing was not done according to or in line with the Medical Residency Training Act, which was supposed to have been captured under envelope of the National Postgraduate Medical College. Rather, it was captured under service-wide board. And that gave us some skepticism of as to the sincerity of the government in paying that medical residency training fund. So we needed that at least we should have some implementation of it in any form.
Mm.
So recently, with our recent engagement, some of our members started getting it. So with that implementation, we believe it was conclusively addressed. So the other issues that are still work in progress include the death in service benefit for our deceased colleague who died from the contagious infection that ranged from Lassa fever, Ebola, and
COVID.
COVID-19. Yes, I think one of the next of kin of our deceased colleague was where they were able to get the death in service benefit, but the remaining 19 are still work in progress, and we'll continue to pursue it in that direction. So those that were under Give Me, our colleagues that were employed under Give Me platform,
Yes.
and all the salary areas of ranging 5 to 6 months before the strike. Some of them were paid to May, and then thereafter it stopped again. So we continued to pursue it and demanded that they migrate them into the IP's platform and subsequently continue paying them on the IP's platform. So most of them were captured on the IP's platform. But we got to a point of stalemate because the government had invoked the no work, no pay. That's Article 43 of the Trade Dispute Act on us, and they were not paying us salary. So they insisted that those who were recently captured cannot be paroled because as long as they are not coming to work, they will not start paying them. So we look at it as we felt there was a need to give a window of some days to see to the implementation of rather to the payrolling of these our colleagues who were recently captured on the IPs, so that their areas can also be subsequently paid to them. The issue of the state tertiary health institutions who haven't been paid salaries for some months, like the issue of the Abia State, we who are owing our colleague about 21 months of salary. We resolve on the Abia State, the absolute. We resolve that they will continue on their strike, even though we are going to be resuming to continue to press home their demands for non-payment of salary, because as it is, they don't even have the money to be going to work.
If you can explain, if you can come, Mr. Ishaya, if you can take that again, please. You're saying which of the Doctors Association would continue with the strike, or which of the institutions?
It's one of our branch, our local branch, Abia State University Teaching Hospital.
Okay, they are still on strike.
Who our members there have not been paid for 21 months. And we understand, or we observe that they don't even have the money to transport themselves to work if we insist that they should resume. So they will continue to be on the strike until they get some of the months being owed to them paid. We have also other states that were not, their demand were not conclusively thrashed out, but it's still work in progress. They will resume and will continue the discussion. IMO owing 8 months, and we have some other states, Ikiti and Ondo, owing 3-4 months as well. So, but it's work in progress. We've urged them to resume while we continue to engage with those state governors for the next 6 weeks and see how we are going to push some of these things to be paid.
What about the case in court? Sorry to interrupt you on that.
Yes, sir.
The case in court, has it been withdrawn? You know, the government took the association to court. Has that been withdrawn, or we still have that matter in court?
The matter has not been withdrawn, but yesterday we had a meeting with the Honorable Minister. They are part of the things that we say they are work in progress. And we resolved that our lawyers will sit and come up with a term of settlement that we can lodge in the court and withdraw the case from the court conclusively. Both parties have agreed that we need to withdraw the case from court as it was signed in a memorandum of understanding.